What do you think about healthcare workers? This is something that happens every year at the hospital here for everybody to get their flu vaccine. And we have these large campaigns, and they tend not to be very effective. Large segments of the healthcare workers here don't get vaccinated for the flu. And I don't think education is really going to accomplish much because I think we've sort of hit the wall there. How do you feel about mandatory vaccinations for healthcare workers?
Well, we lived through this for the last 10 years in our hospital. I mean, in the early 2000s, maybe 35% of our healthcare workers were vaccinated. By healthcare worker, I mean anybody who could walk in the room. So not just nurses and doctors and nurse practitioners, but also, you know, the unit clerks or environmental services or dietary, anybody who could walk in the room. And then we sort of launched this major sort of educational campaign to try and get people to understand what the disease was, how it was spread, and how the vaccine worked. And we had raffles, and we gave away tickets to like the Philadelphia 76ers when they still were competitive and stuff. I mean, it was good, and that got us to around 67%. Then we had a declination form that read like it should have a skull and crossbones on it, right? I know that flu can come into our hospital. I know that I can transmit as a healthcare worker flu from one person to the next. I know the person who I transmitted to may not be vaccinated because they can't be vaccinated. I know I work around a vulnerable population of hospitalized children who could catch flu and die from it, and I'm still choosing not to get vaccinated. And 20% of our healthcare workers signed that form, and then we'd had enough. We thought we'd had 2 children who died in our hospital, both little girls, both were young, neither came into the hospital with flu, both caught flu in the hospital and died. And so we thought it was not our right as healthcare workers to catch and transmit potentially fatal infections, that we have a responsibility that's greater than that, and so we mandated a flu vaccine. So in 2009, if you didn't get a flu vaccine as a healthcare worker at Children's Hospital of Philadelphia, you had 2 weeks of unpaid leave to think about it. If you still didn't get a vaccine, you were fired. So we fired 9 people in 2009,
Wow.
and it hasn't happened since. But what we didn't allow, we obviously wouldn't allow philosophical exemption. We would have allowed, because such is the nature of life in America, we would have allowed a religious exemption. I was actually put in charge of that the first year, and I got mostly I just got a lot of notes from yoga instructors, which didn't count.